Hello, good evening, and welcome once again on another Sunday talk. So today's talk is about integrative medicine, some of the basics about integrative medicines. And my friends who have attended my talk in Chennai, they already know it, but I shall repeat it so that they understand it. And these principles were devised by Dr. Andrew Weil. So all credit goes to him for bringing us all together and making a head start towards the integration of various medicines. So if you look at the history has been very harsh on the natural science, right? Right from the time when humankind came into existence, and every time they had suffering, they found the solution in nature, right? Even today, according to the WHO, 40% of allopathic medications are based from the plant kingdom. So even today, we can't keep them away, even though we have that lab-made medicine that are available. So we can't outrightly reject the natural sciences. So if you look at natural sciences, the oldest natural sciences that we know of is the herbal science, right? It's date back to way back to BC or whatever is available in the history. So in India, we know that Ayurveda is as old as the Vedas that were written, and before that also Atharvaveda existed. Before that also we all used to use some of the herbs. Now, what was the reason, or how they used to, use the herbs? Any idea? Anybody has any opinion on this? Like, how did the first guy actually thought of using something biological and he used it? So if you have any idea, I think you can let me know. We can discuss on that, because this is an interesting thing, and now it has gone into hidden, or it has been hidden from the plain sight. Any idea?
It was mostly instinctual, and a lot of trial and error also was there.
No,
like
no,
so
no.
animals can
No
understand
Ah,
what plant they have to eat if they have a stomach upset or something. So something like that could have started the whole thing, and then it was passed on from generations to generations about the plant, I guess.
yes, that is what it looks like. So if you look at, I think the human systems, I don't know, this looks something different. Sorry. So whole thing actually, the humans kept on observing the nature and found. But biggest thing was doctrine of signatures. Doctrine of signatures, that is where I think we are based out of. The humans, like, why do we like certain kind of people right away from the first look? Why do we hate certain kind of people right from the first look? That sense is comes from the doctrine of signatures. And the doctrine of signatures is the one that was responsible for herbal medicines. And that is how the herbal medicines came into being, right? So I think last last time also when I was talking, I was telling that sometimes I may get some emergency patients. So I will have to excuse me. I'll just pause the recording. In the meanwhile, if you want to discuss something, please do. I'll just come back. Sorry for the interruption.
Observed you yourself for 7 days, you will probably learn something about the sickness.
Right. Yeah.
Anyways, I'll have to edit that. So thank you for your patience. So when we look into the science, exploration of science, I was talking about like how the medical field might have developed is because of doctrine of signatures. And we look at the humankind and the environment that is made around us is what we learned from our own body, what we learned from nature, we cultivated that according to our needs and comfort. That is again very important point. And when we look at the natural sciences, the best thing about natural sciences is they learned life, and we learned it from them. In the sense that whatever we learn is by dissecting the dead first, and then when we do a biopsy and look into that, it's already a dead material. So somehow, it sounds very big, but the exploration, the scientific exploration was much needed. And because of that, we can actually understand the natural sciences in much better and larger way. Because there are, of course, small things that we don't understand right away even today, even with the best sciences that are available. But I think when we combine the whole thing, somehow, I think to the best of our abilities, we can remove those lacunas that are there in modern medicine, that are there in other medical things. So let me start with the smallest presentation that I've made. So I've termed it as integrative medical cases, but I'm not going to discuss any live cases. Yes, we'll discuss something very short so that we understand this. So the first thing that we should understand is what is integrative medicine and on what basis did the integrative medicine came into being. So that this is the principle that was devised by collectively and especially by Dr. Andrew White. All credit goes to him. And these are the principles on which integrative medicine is based, so that we don't open the book every time we see a case, right? So when we have these things in mind and we have our own exploration, so think this. So the first important principle of integrative medicine is the patient and the practitioners are partners in the healing process. This is what we have to educate to the patient. We have to educate, take our time out, talk to the patients and tell them about what is their disease and how the healing process is going to happen, or how do you plan for the healing process, right? So that is the first and most important one. And this is where we differ from the modern medicine, right? Because somehow we don't involve them, but there are doctors who have been doing that. I've met so many very important doctors. So the second principle is all factors that influence health, wellness, and disease are taken into consideration. This is very important aspect. So we have to read about the disease, we have to read about the life, and understand what actually affect the health, the wellness, and disease. And then when you look into that, we have to integrate the mind, body, spirit, and community, because the community also plays an important role, right? So we see that how the health groups can actually bring about. There are the health groups, like for example, when I met this particular group from ALS, amyotrophic lateral sclerosis, I was very happy because they are helping one another. I got better with this, so let's do this, let's do that. So the community building is also very important, and that is where we are good at when we look at integrative medicine. The third principle is we use conventional as well as so-called alternative methods that facilitate the body's innate healing response. So we use the modern medical scientific methods where the pharmaceuticals, we use the alternative medicine, the natural sciences, I would put, like, for example, the Ayurveda, the traditional Chinese medicine, the massages, all that can help, which we know helps in the body's innate healing response. Say, for example, stimulating the immune system, stimulating the endocannabinoid system, stimulating the detoxification, stimulating the chelation process. So all these things we use both in conjunction to the best of our ability. And the most important aspect is how do we integrate it? So that is where it comes to be a very fabulous system. Initially it looks like there are two different systems, but later on we understand that it's one and the same. And the effective interventions, according to the next principle, is the effective interventions are natural, they are less invasive, and we should use them whenever it is possible. And for that, we need to understand, we need to explore that. That's why we have to learn this integrative medicine. And the integrative medicine neither rejects conventional medicine nor accepts the natural therapies uncritically. So this is the next principle. So anything that we do, we have to be critical about it. Like, for example, if I have to use, say, for example, ashwagandha, I have to critically think about it, whether it is really beneficial for a given patient or not. Like, for example, if you want to use acupuncture in a particular patient, you need to understand whether it will be really beneficial to that or not. So you have to think critically. You have to think not blindly, not faithfully, but critically. So that's what the integrative medicine says, that we neither reject conventional medicine nor accept the alternative therapy uncritically. So we know that if you use painkillers for a long time, you're going to get kidney disorders. We are going to land up into so many side effects. So we need to understand all those things together, right? And the good medicine, according to Andrew Weil, is based on good science. And the good science is inquiry driven and open to new paradigms. So we don't limit ourselves. Oh, no, only we understand this to be. No, we go into the new things that are coming. When the integrative medicine was developed, that time endocannabinoid system was not there. When you look at the latest books, they have included endocannabinoid system into their integration. So it is always inquiry driven and it's always open to new paradigms that come. Alongside the concept of treatment, the broader concepts of health promotion and prevention of illnesses are also taken into importance, or they are paramount importance. We just don't treat the patient, we also promote their health, and we also get into the preventive aspects of that same things, right? And the most important things, which most of we know that what IMA was doing, right? IMA was worried about their doctors dying from lifestyle disorders. Why? Because of this. So in integrative medicine, it is very important that the practitioners should exemplify the principles and commit themselves to self-exploration and self-development. You have to adopt these processes to yourself. I have to use it on my own self. I have used it on my own self. I've found it. That's why I'm here in front of you speaking about it with so much convention, with so much faith, because we've seen the faith, we've seen the trust, we've seen the real good science that is behind integrative medicine. And I've used it for myself, I've used it for my family members, and that's why I'm here in front of you, coming to speak to you. Somebody needs to. I'm not able to. Anyways, let's get back. So I hope you understood the principles. You can go back to the video again. You can look into the integrative medicine website where these principles are given and the explanations are also given. And you keep inquiring into this and find out. Now let us look like how does a typical integrative medical treatment is like. So I put it as integrative interdisciplinary tools, because it is not from one discipline, it is from different disciplines. So if you're in a typical given scenario, these are the things that we need to understand, right? So the first thing that we need to understand is removal of exacerbating factors or lifestyle changes, as we call it. So we have to understand the lifestyle that the person is living and accordingly change the lifestyle to suit or to get rid of the hurdles towards healing. So we would better mention it like we remove all the hurdles towards healing. So that is why we modify the lifestyle, the diet, right? This is the most important, the first aspect of this. And once we remove this, then we look about the diet, the nutrition that is needed. And then we look into the supplements that are available And those supplements should not be blindly used, right? Because the good science is based on inquiry driven. So you need to find out which is the supplements that are going to work. It's not like that I give a blanket treatment for few supplements. Okay, this supplement should go to all patients. No, you should not. You should change those arrangement as per the disease. You change those supplements as per the things. Like for example, if I want to take it, like for example, I stay in a rural area in Kerala. So here people are exposed to sunlight much better. And I've seen that averagely their vitamin D levels are always high. It's around 50 or above 50. That's what I've seen whenever we have tested. So I'm not going to put them on vitamin D. It's not like blanket we use vitamin D on every case. It's not like we use all half. When it comes to water soluble vitamins, yes, we can give them extra. So we can prescribe that. But again, if you know the science behind that, that is why it is so helpful. And then we should understand the botanicals. When it comes to botanicals, we have the Ayurvedic supplements, the herbal supplements, we have the Chinese herbal supplements, we have the African herbs. Such a vast, range of herbs are available. And apart from that, we have the herbal microdosing in the form of homeopathy, in the form of traditional Chinese medicine. So you have a whole range of botanicals, and you need to study, and you need to understand which herb will work best on which condition, right? We'll discuss as we discuss the case. And then we understand the pharmaceutical, because we are basically graduates from the pharmaceutical. So we understand pharmaceutical. So if these things are not working, then we definitely try the pharmaceuticals, right? And then if that is not working, if surgery is needed, right, we should even prescribe surgery. We should do that. So in a typical case scenario, which will be the first case that I would take is, I'm sorry for the, I would take that benign prostate hypertrophy. This is an ideal kind of case scenario that we look into this, right? So we see so many cases. We look so many cases when we do our practice, okay? So there's something called as IPSS scale, no? Right? So you can look into this IPSS scale. It is online available. You can look into that scale and find out. So if the IPSS scale is scaling, the symptoms that are presented is below 90, no, then you don't see any benefits from use of pharmaceutical. So if the IPSS scale, if the symptoms are so bad, it is above 90, the rating, then I think we can go for alpha blockers or surgery. Because alpha blockers, which are the main drugs that are being used, even anti-testosterone medicines that are being used, finasteride and all those things. So those things can be used. But then we have cases where there is mild to moderate benign hypertrophy, where PSA levels are fine. So in that, what we do? Can't we avoid the surgery? Yes, definitely we can avoid. That is where we come into this. And the first thing, according to the management, is removal of exacerbating factors. Now this becomes individualistic. And all exacerbating factors that are there, you need to understand. And the most important thing here is stress, right? So the common complaint is I'm not able to pass urine freely. So the word here had to be highlighted is freely. So the patient says, I'm not able to pass freely. Before I used to do. So first thing you have to tell is, why don't you relax yourself? Go for urination, just relax. Allow the detrusor muscle to relax and contract on their own, rather than forcing, rather than inducing it by the adrenergic muscle. Right? So some of the factors you have to ask to the patients, and you have to note for it. And only after that, we do. Now, when it comes to nutrition, before I speak, because I'm not going to speak out bluntly, I is just a kind of, making you get interested into integrative medicine. I'm not going to blindly tell you anything. When it comes to nutrition, what is the single most important factor that can exaggerate the prostate enlargement? Any idea? Please, doctors, if you know anything that you have seen in your clinic. which you feel is very important, you can talk about it. So what is the single most important thing that you would like to stop in a patient who is 60 plus? Now it has become 50, 45 plus. I get cases of 45 plus who are having BPA. So now what is the one thing that you would suggest them not to do? Nothing? Okay. So I would put it on individualistic thing, nutrition when it comes. On a blanket way, I do tell them no gluten, no dairy, because we know that can cause the inflammation, right? That can even be. So, there's one thing that we always miss. It's not always testosterone that is cause for BPA, right? There's something else. Any other hormone that is very important. Any idea? Looks like.
Is estrogens?
Yes, estrogen, because we eat a lot of xenoestrogen or phytoestrogen right today, where that is becomes very important. So it is not always the testosterone that is responsible. So that's why, so in nutrition, it should be based on that. And xenoestrogens are filled with, when you look into the packaged foods. So you need to understand everything depending on the scenario that you are in. So if you are in metro cities, definitely packaged food will be the biggest reason for them getting this benign prostatic hypertrophy, right? Okay, that is better. When it comes to supplements in prostatic hypertrophy, these two supplements are found to be very, very, very beneficial. That is beta sterol, phytosterol, if you want to put it in that way, which is very widely used. And it is one kind of phytosteroid, if I want to put in that. And the second one is zinc. So zinc is found to be very beneficial in reducing the inflammation that is there in prostate, and also the congestion that comes with it. And zinc in another study was found to be as effective in mild to moderate as alpha blockers in that state. So we can include zinc and we can include beta sterol. Now, if you want to put it in that way, do you know of any one Indian herb that works very good in prostate hypertrophy? Usually dosages are 50 milligrams that we see. So I stick to 50 milligrams. Any idea? No?
Sarsaparilla, Nanna.
Okay, sarsaparilla is okay. That is, but more than that is widely available and that is actually promoted for sexual health is kapikachu. It works very well. Okay.
Shilajit?
Also, not Shilajit, kapikachu. Kapikachu is what Miguna proteins.
Is this bonduct nut? Bonduct nut is also used for PCOD and prostate issues.
That is also. Now, coming to the botanicals that they have found effective is saw palmetto, or rather Sabal cerulata as we call it. So that is found to be very, very effective. And it not only shrinks the prostate, it also has anti-testosterone activity, and it also has the what you call stimulating the fatty acid synthesis inside the prostate. So saw palmetto becomes the single most important, and the dosage is also that is being given in the integrative medicine is 160 milligrams twice a day. They also use ryegrass pollen, pygeum. These are the other herbs that they I use a single thing. It is the product is named as Ashwamedh. It's a product made by Microlabs Herbal Division, and I found it to be very helpful in prostate. It's a combination of 6 herbs. I don't remember the names, but it's a combination of 6 herbs, and I've used it in all cases of BPA and found it very helpful in reducing them. Okay, so that is it. Then another thing is when it comes to botanicals, Then we have the homeopathic micro dosing that we do in the form of mother tinctures. And in that, we use half palmetto again in the form of Sabal cerulata. And the second most important thing that in homeopathy they have found is hydrangea. Hydrangea is found to be very, very useful. And you look into the list of medicines that work in BPH, very, very huge in homeopathy. So there is Conium maculatum or Cockroaches herb, right? So even Conium maculatum is found to be very effective. The simple herb known as Bryonia alba is found to be very helpful. And like Dr. Shruti said, Sarsaparilla is also found to be very helpful. So all this medicine will work. Now it depends on your expertise and knowledge on how to use them in this most particular scenario. That's why I'm not discussing any case scenario, because when I take 4 cases, I usually give some things are similar and most of the things are different. I've even used a simple strain thing that is known as monologue in one of cases, because somehow the case was basically that of constipation, where I found that even the prostate hypertrophy was there. So I had given them monologue, and I found it very effective in controlling the size of prostate. And pharmaceuticals, I know we know a lot, whether it's alpha blockers or anti-testosterone medicine, or even the combination of alpha blockers and that we use. Surgery, we know that there are so many variety of surgery. And still, I think PSA seems to be the golden standard. So if the PSA levels are high, we think maybe it is going towards the prostate cancer. So PSA levels always is taken as important, apart from the size. So if you look at BPH, so we have such a beautiful combo. So if you remove the exacerbating factors, change the lifestyle, ask them to practice the mind-body techniques, relaxation technique, yoga, or Tai Chi, as it is called, or even simple visualization exercises that can take the stress out, and then do some nutritional changes like stopping the packaged food, asking them to stop the dairy and the gluten. That can also add up to the inflammation. And then using the supplements based on the science that we know can really be very helpful. So this is just like I'm taking this right from the textbook. These suggestions are right from the textbook. These are not from my own experience. Now, if you want to mine experiences, as I told, 4 different cases, I'll do it simply. In one case, I had used only and only hydrangea, and I got very good results. So it depends on the symptom severity and also the patient's urgency in doing that. Most of the common thing that I am seeing the young people with PPH is they come with the complaint of they're not able to have intercourse normally. That is what the males come with the complaint of, and they have already tried Viagra. That is what seems to be funny, because actually Viagra can increase the symptoms, right? The adrenergic drugs will actually increase the symptoms of PPH. And funnily, some of the doctors, they prescribe that. They've even prescribed the medicine that are used for erectile dysfunction. And instead of getting better, they come with worsening of the symptoms. And then we need to understand and take care and then do that. That's where we need to use some of this medicine. Because of my friends who know that I do a lot of cannabinoids. So is CBD helpful? Yes, it is helpful. But in the sense of it becomes an anti-stress mechanism where the stress goes down, and somehow it may reduce the signs of prostate. So we don't have a definite studies where cannabinoids can actually reduce the stress. But when it comes to prostate cancer, yes, it works wonders, because somehow there is transition from BPH to cancerous. That transition actually excites the availability of cannabinoid receptors, and then they work better. In prostatitis, yes, it can work better, but not in BPH. I have not found that using only and only cannabinoids is beneficial in benign prostate hypertrophy. The second most important cases that we come across in females is PCOS, polycystic ovary syndrome. And we know how complicated this is. is look at the complexity of alcohol. So it's such a complex endocrine and metabolic nature in that. So again, according to that, we have to decide on the treatment plan. And I tell to all my patients of PCOS, have you gone to Google? I always ask. And they said, no. I said, you better go to Google. Because what is the best thing is, even in the Wikipedia article, the first thing they write is diet and exercise is the most important aspect in treatment of PCOS. That's what I want them to know, that even Google is saying that. And why don't you become active and change your lifestyle, right? And we know just by changing the diet and lifestyle, the PCOS goes down so much, right? And we know that the medicine that we are using, so we are using the anti-obesity medicine. We don't have any, that's a different thing. But still we try those techniques and it works very well for PCOS. Again, if I want to ask you, what is the single most important hormone that actually is responsible for PCOS? Any idea?
Insulin.
Insulin.
Yes, exactly. So we can, sorry, just a second. So just if you look at insulin metabolism, and if we can get into that insulin sensitivity issue, I think we can resolve the PCOS so easily, right? And we have found it to be very effective. So same thing is, we look at the integrative approach that is coming from the textbook. So again, when you look at the lifestyle modification, diet and exercise, yes, you have to go with a low carb diet. You want to go for keto diet, it's up to you. I'm not a very keto guy. I'm not very for it, not it, I'm against for it. So diet and exercise. Exercise is definitely, yes, you need to incorporate. Avoid alcohol. There is no role of alcohol. It can only exaggerate the PCOS because alcohol can reduce the effect of insulin. We have seen that happening in diabetes also. Tea and coffee, because ultimately when they take tea and coffee, they are going to add sugar. They're going to add some sweeteners, and that can be really detrimental. Even the artificial sweeteners are also detrimental. You look at the supplements that are suggested, it's single most important supplement they write is chromium picolinate, because that actually activates the residual insulin that is there. So insulin resistance is again a main cause. So we use chromium picolinate. Again, same thing is what cinnamon does. Cinnamon is again the activator. Through the PPAR receptor, cinnamon can activate the insulin. So again, cinnamon is very important. And we have seen that laziness is single most important. That's why ginseng can be really beneficial. And there are studies where vitamin D has shown to be directly beneficial in the cases of PCOS. So that's why vitamin D is also needed. Even if the levels are normal, we use vitamin C. And we know that N-acetylcysteine seems to be so effective in PCOS that people who don't do anything, I tell at least you try NAC. If you can't take the tablet, you try the effervescent tablets. And I've seen people coming back, the girls coming back after 6 months and telling, thank you for showing us this way. And NSC acts in various ways. It is best antioxidant. It is again anti-cystic, if I want to put it that. The mechanism in which the cysts are formed in ovaries is taken care of by NSC. So again, NSC N-acetylcysteine becomes so important. And when it comes to herbs, I think the single most important herb that has been found to be effective is Vitex, against cactus. And when it comes to other things, so again, I'll leave it up to you. The myo-inositol. People, we use myo-inositol and we've seen how beneficial it is. Again, myo-inositol can be used. And then I leave it up to you. I've seen that there are cases of PCOS which were resolved by use of simple homeopathic remedies like pulsatilla, calcarea iode. And I have used, it was a shocking incident for me because I found this particular girl to be very arrogant. And I used Kali Brown, a Paulus solution as we know for it. And it resolved that case. So we have so many approaches that we can do. But again, remember, it is not easy to maintain the cure till that particular patient gets pregnant, right? We know all that. So I finally say that if you get pregnant, this is easiest to solve. And to get pregnant is also not so easy. But there are cases where there were PCOS, they didn't take any treatment and they got pregnant also. So the mystery is insulin. And somehow, if we can actually resolve that mystery of insulin, we can definitely take care of PCOS. And don't forget, insulin is the only thing that we have to reduce our blood sugar levels. There is much more to insulin than what we know about that. Then we have acupuncture that really works fantastically. I met this particular doctor who uses acupuncture extensively in PCOS, and I've seen it really does wonders. Because acupuncture again can shift, it can work at the level of mind, body, and temple. And we know that stress is again very important. The stress, performance, tension that the girls undergo. So that's why they resort to alcohol, tea, coffee, stimulants, which ultimately again result in insulin issues and thereby creating PCOS. So we can use the mind-body techniques, bring down the stress. And again, cannabinoids, I've used cannabinoids single-handedly, means just as a solitary, along with the diet and exercise, without even using chromium and vitamin D, and I've seen results. And especially with the equal ratio of CBD and THC, because we know that THC acts like pyroglycogen. It acts like metformin, which we use commonly in PCOS. That's why I have not written anything about medical management. Because in medical management, what we use metformin, we use anti-diabetic drugs, and we use drugs that actually up the metabolism, right? So that is what we do. Even if the menstrual cycles are so irregular, some of the doctors even put them on OCP, though I am not a fan of OCP. I don't use it, but even there, that is used. And there are so many other things that can be used in PCOS. But then again, we have to individualize. Because when we individualize PCOS, because I still remember this one particular girl, she told me, I'm not going to do anything. No diet, no exercise, no matter what you say, I'm not going to do anything. But if you prescribe me a good medicine, I'm going to take that. And that particular patient, I prescribed only one medicine. That was 1:1 ratio of CBD and THC. From 120 kgs, she came down to 74. Then she got pregnant, and now she is mother of 2 kids. So there's so much variation, so much things that we can use in PCOS. And if we can actually individualize it, we reduce the failure, right? So that is the PCOS, the typical example of PCOS. The third most example that we have is of seborrheic dermatitis, dandruff. So tough it is to handle, so tough it is to cure, right? Now, why it is so tough to cure? Again, we forget that seborrheic dermatitis is not a simple disorder of scalp. It's a disorder which is coming from the inflammation that is there inside us. So that's why you need to have a complete overall of the lifestyle in order to get rid of diabetes. Dandruff. Because I get so many cases of dandruff, that I was actually like, okay, what do I do? So, but I have somehow striked at one homeopathic formula that was very brilliantly, and I've seen that it works for most of the cases, unless it is an oily scalp. So, okay. So now what does the integrative medicine says about seborrheic dermatitis? The first and the most important is low carb and a high fat diet. Because somehow at the level of scalp, the moisture level is so low. So we need to understand the low carb and high fat diet. And the supplements is all that we can use. We can use the fish oils, we use BPA, DHA, omega-3. We know that, single-handedly, vitamin B complex alone can actually resolve this dandruff issues. And vitamin E. Again, vitamin D also, though I have not mentioned it, vitamin D also. So if you use this properly, now how do we use properly? You can ask them to take orally, or you can even ask them to apply on their scalp. I have even asked people to shave off their head and apply these things. So this particular capsule that I have used is Evitol, EVITOL, because it's combination of EPA, DHA, omega-3, and also tocotrienols. So I just tell them to use it on the scalp and see. And since the time I've used it, it is really very good. If you use it in excess, you're going to get migraine. So that is where you have to be careful. We know that anti-fungal shampoos like zinc picolinate, ketoconazole, even the oral, some people use even oral, they also use them. Now, when you look at add-on therapies, there are so many of them, and maybe all of them work, maybe some of them work. And already, most of the people, they have tried already the add-on therapies. Like, for example, changing of their oil, trying to oil their shampoo, trying to use head and shoulders shampoo, right? So all they might have tried and then they come. And I have struck that particular formula when it comes to homeopathy, where the formula is designed to reduce the inflammation at the level of scalp. So you have to use that mother tinctures on the scalp. So what I tell is I ask them to use it in coconut oil, just warm the coconut oil and mix it nicely and then use it. And I have seen that within a matter of 2 to 3 weeks, the seborrheic dermatitis or dandruff actually begins to resolve. So this is what I wanted to create an interest, because these are the sum of the diseases that we come across. So I thank you all for joining in for today's talk. If you have any questions, please WhatsApp me because I'm running short of time. So thank you all and thank you for joining me. See you in the next thing. And we are going to start with the homeopathic course, a small introductory course, so that you get interested into homeopathy and start exploring, because it is really vast science that we have. So thank you for joining me.